name is Ricky Watson, and I contracted mucormycosis in September of 2020. I got it in my face, my left side of my cheek, where it was eating away kind of my cheekbone area and up into my eye socket and down kind of my lower jaw. And that's where eventually that I was able to get to UAB and meet my doctor, Dr. Peter Pappas at UAB. Please, doctor, go ahead and.
Hey, Ricky, how are you doing?
I'm good, sir.
I'm glad to see you and glad that you're doing well. My name is Peter Pappas. I'm a emeritus professor of medicine and infectious diseases at UAB. I've been there for about 38 years, and my focus has been fungal disease for most of that time. I run the mycosis study group central unit, which is a large clinical trials unit centered at UAB, but involving centers all over the country and really all over the world. So we see a very broad array of patients with invasive fungal infection and many with very severe infections like yours, Ricky. And so I'm glad to have this conversation and to answer some questions and go back and forth.
Yes, sir. Thank you, doctor. Yeah, I think that's very important because one of the things that happened in my case is that we, in my area where I'm living, we don't have any specialists really for fungal infections, and I think it's very important to make sure that you find a specialist, you find a organization, a hospital that knows what they're doing and how to go about with treatment, and just don't let any general practice kind of take the reins. I think it's very important to I was blessed to find you. You're one of my heroes, and you helped save my life, doctor, and I'm grateful for that. Thank you.
Thank you, Ricky. You're one of my heroes. So we have mutual admiration.
Yes, sir. Thank you very much.
For sure.
I'm going to start with this. The first question here. Just explain just what is mucormycosis and kind of who's at risk.
Sure. So mucormycosis is a broad term for a number of different fungal infections that are in the same family. Something that everybody can identify with is bread mold. We've all seen bread mold. We've all seen mold growing on, rotten vegetables and stuff like that. Well, the organisms that cause mucormycosis are very similar, in some cases the same as organisms that you would identify as bread mold. So these germs are everywhere, and there are many different species. There's not just one particular species, but they're all related. They're all like first cousins to one another. And they're throughout the environment. They're there to break down organic matter. So, they allow, vegetation and, dead material to be broken down into its components, carbon, water, etc. When humans come in contact with them, when we do all the time, really all of us do all the time. I mean, they can't be avoided. These spores are everywhere. We usually handle it. One of these spores, we might inhale it. A white cell comes in contact with it and it gobbles it up. But occasionally, people who are at risk, and I'll talk about the risk here in a second, but occasionally people who are at risk will develop infection to this organism, which is so common in the environment. And sometimes those infections, I'd say more often than not, those infections are pretty subtle to begin with, which is why they go on for a long time, sometimes before they're diagnosed. Yeah. The people that are uniquely at risk are people like yourself. They are typically people with diabetes, usually insulin requiring or insulin dependent diabetes. but also, diet controlled diabetes or so-called type 2, people with iron overload disorders, and then a growing population of people who are like transplant recipients, both stem cell transplants as well as solid organ transplants. And then a large growing group of people who receive these biologic agents, like for rheumatoid arthritis or for lupus and so forth. So, the categories are largely diabetics, transplant recipients, and then people or on high dose steroids. That's kind of that constitutes about 90% of the group that get mucormycosis, and there's a small group of people who get mucormycosis that have nothing identifiably wrong with them in terms of their immune system.
Yeah, it's very interesting. Because I'm a type 2 diabetic. And then also during this time, I had also contracted COVID-19. So that kind of weakened my immune system also, you know.
Right,
And
right.
I didn't learn that, as you were saying, like it's everywhere until when we were at the conference in Denver, Colorado with MyCare, that it's so prevalent like that. But yeah, yeah, and they still, don't know how, at my time they were guessing because I kind of went through Hurricane Michael, here in the Panhandle of Florida, and they thought it was like a remnant left over from that, and that I possibly got it from, tap water. I mean, outside playing with my dog. They had no idea. So it's, yeah, but
Yeah,
so
and
I
you
would
really don't.
definitely.
Yeah,
I'm
and you
sorry.
really don't have to. You
Yeah,
really don't have to do anything special to get it,
yeah.
because it's in the environment. But certainly, if you had just been through a hurricane, you've got all this downed trees and vegetation, a lot of
Hmm.
material that's being decomposed. You could make the argument that there's a lot of mucor in the environment. And the other thing you said that's really interesting is the COVID connection. Um, at the same time that all this was going on in India, in India, where
Hmm.
diabetes is really prevalent and COVID was out of control, for about an 18-month, 2-year period, they had over 50,000 cases of
Wow.
mucormycosis associated with COVID. It was usually post-COVID, oftentimes in association with high dose steroids, but diabetes and COVID were the two constants in that outbreak. It was
And if you
nothing.
get them both,
Oh my
hey,
goodness. Yeah,
prime pickings. Well,
yeah,
you know.
yeah.
But it's one of those things like I going back to what I said before. That's why I think it's very important to make sure you seek out professionals and start there. You know, yeah, and UAB, you guys really, you treated me very well. You know, you, and also Dr. Thomas, who, actually took my leg bone to reconstruct my face.
Yeah.
Just the stuff that you guys did. And I just can't say enough good things about you guys.
Well, thank you. I think that, in fairness, um, while the spores, the agent of mucormycosis is everywhere, the disease is relatively uncommon. And so it is one of those conditions where um, you do need specialty care. Not every, family practitioner or internist has seen this. Um, it oftentimes goes unrecognized because the symptoms are subtle and they're kind of slowly progressive. I think you can probably attest to that. But when it is determined that a person has this, they they almost always end up in a large medical center because you require multi-specialty care. You require an infectious disease person, but you also require an ophthalmologist. You did an ENT person that can do the appropriate debridement because the treatment for this, sadly, is not just antifungals. It's antifungals plus usually surgery, and that surgery can sometimes be disfiguring, and
Yeah.
it can lead to loss of organs, vision, etc. So yeah,
Yeah.
yeah. But
No,
that's
they
why
still kept me. Yeah, they still kept me beautiful. So yeah, I'm thankful for that.
no question, you're beautiful. No question.
Is there any
Yeah.
way to prevent mucormycosis? And what are some of the symptoms to look out for?
Yeah, I wish I could tell you that there's a way to prevent mucormycosis. I think in terms of preventing exposure, I think if you live on the earth, you're going to be exposed to this germ
Okay.
anywhere. But it's probably more prevalent in moister, hotter climates. I don't know this for a fact, but it does seem that we see more of it, in the deep south of this country. Again, India, Southeast Asia, places like this, whereas in colder areas, you would expect it to be less common in the environment. But again, exposure is just a factor of living on the earth.
Yeah.
I think that things that maybe the question is, how can you diagnose this early? What should lead you to seek,
Right.
some attention for this? I think the if you say, where does mucormycosis occur? It occurs first and foremost in the sinuses and in the face. It
Mhm.
also occurs in the lungs. It also occurs in the GI tract and even on the skin. And but if I'm a diabetic and I have sinus symptoms that aren't going away, it's more than a cold. It's lingering types of uh, symptoms that maybe it's congestion, maybe it's pain, but certainly if
Mhm.
if those types of symptoms persist, um, then you need to get seen. And
Yeah.
certainly those types of symptoms that don't respond to antibiotics or to typical topical types of treatment, should lead one to have a very high level of suspicion for something other than a bacterial or an allergic type of sinus problem. Um,
Mhm.
I don't recall all the details, but I'm guessing that you went to see a practitioner. They probably gave you antibiotics or antibiotic
Yeah.
drops,
Steroid shots. Yeah.
steroid shots, and
Mhm.
and it didn't work. And it
Right.
didn't work because you were incubating, if you will, this smoldering fungal infection. So,
Mhm.
I mean, picking these up early requires some foreknowledge that this disease exists. And that's one of the reasons that we're having this discussion, so that people
Yeah.
understand that this can be a pretty morbid um, complication. It sometimes takes people's lives. And
Yeah.
just being aware of its possibility that it's out there is is really, important. But I think the first thing would be, depending on what organ is involved, a skin lesion that doesn't go away, a cough that's not going away. And in the sinuses, where it's most common, sinus symptoms that just aren't resolving with what, should have been conventional, effective type of therapy. Those are the
Yeah.
types of things that would get my attention.
Mhm. Right. And I guess there's really no way to kind of speed up this process, or is there?
Uh, Having a high level of suspicion. I think the only way to speed it up is to say, um, this person um, has come in, they've had 6 weeks of sinus symptoms, and they're, a diabetic that's poorly controlled. Um, I think we have to rule out mucormycosis. So the way we speed it up is by getting people mobilized. So in my case, it might be that I would call my ENT colleagues and say, hey, Mr. Watson is over here. I'm really concerned about him. I'm concerned that this is mucormycosis. Need you to scope him and do, a examination of his nasal passages, and so forth, and just look to see what the lining of those sinuses looks like. When they're deeply involved with mucor, those tissues die and they turn brown or black. And it's usually pretty obvious to, even a casual observer that something's amiss. So I think the biggest thing is getting the right people involved very early, because your diagnostic tests, at least the indirect ones like a blood test, are going to be, while they may be positive, they're not going to really necessarily direct you to the exact answer.
Yeah. And I think it takes, kind of an open-minded, physician or doctor, because in my case, like, I went in and it took literally, a month before we actually figured out that it was mucor. Because at first, oh, it's just a sinus infection. And then it
Yeah,
went from there, well, maybe I think you got an abscess tooth,
yeah,
and we kind of just kept going, and I wasn't getting better, and I was still taking, medications and all that stuff. And so yeah, it was just until they finally, like you said, took the culture, did the blood test, and then figured it out, and then got me into, where I basically went straight to, ICU, and eventually they started working on me, So, but
yeah.
yeah,
I
and
mean, I
then
think your story I mean, unfortunately, it's all too typical, because the symptoms are not. I mean, everybody has sinus infection, right? But
yeah,
in our diabetics, in our transplants, we need to think of a sinus infection as always as potentially mucor. I mean, not. I mean, particularly among individuals where symptoms persist. And so, I would say, on average, when we see people who have mucor involving the sinuses, their symptoms have been going on for weeks, if not months. And so there is ample time to go in and do this. But it also testifies to the fact that this infection smolders, and it's not super dramatic until part of your face goes numb, or you lose vision in an eye,
right,
or some other thing that you simply can't ignore. So,
yeah,
I, it is something that I think, I mean, it's why we're having this session, because it's under recognized, at least in a timely way. And so,
right,
your story is the rule and not the exception.
right, yeah. hmm Now, what kind of medications and treatments are used to treat, mucormycosis?
Okay. Well, most people with mucormycosis, they're going to get started on a drug called amphotericin. Um,
Yeah,
and
that's what I had to be. Yeah.
yeah. Amphotericin B, and amphotericin has to be given by vein, at
Yeah.
least currently. Um, and it's useful, but with mucor, it really is a concerted effort. This is where you really need an orchestra leader, because you need antifungal medication, you need an ENT doc who's going to come in and do enough debridement, remove all the
Mhm.
dead tissue. Sometimes you need an ophthalmologist, so you really need a team. But the antifungal part of this, which is what, of course, I get involved in, is the amphotericin B. It has to be given by vein. It causes kidney problems, which often are pre-existing in many diabetics. It causes electrolyte problems, and it's hard to take it. And so I think on average, we probably administer this for a month, maybe 6 weeks, to our patients who are doing well. And then we transition to an oral medication. And that medication can be either posaconazole, which I think is
Yeah.
what you received, or
Yep. Yep.
isavuconazole. We don't know how long to treat it.
Yeah.
Basically, what we do is we treat it until our surgeons can go back and look in the sinuses or look at the lung or wherever it was and say, that disease is all gone, and
Mhm.
visually. And then we will generally treat it for another month after we get that word that the disease appears cleared. We'll treat it for another month, and then be done with it. Now, there are some who have persistent disease. For instance, maybe it's gotten into the base of the skull. And, you know, of course, on the other side of the skull is the brain. And so we're not
Yeah.
going to mess with that. That person may be on posaconazole for a lifetime and
Yeah.
in order to just keep them out of trouble. But
Okay.
it's important to emphasize that it is the combination of antifungals and effective aggressive surgery that actually is what leads to the best outcomes.
Gotcha. Yeah. Now, are there, this was 5 years ago when I was going through all this. Is there any
Mhm.
new developments or medications that you guys are doing now that, wasn't afforded me back then?
Well, there's one drug in phase 3. It's called fosmanogepix. Um, it seems to have a very good, anecdotally, it seems to do well among patients with mucormycosis. We've had some good experiences for patients who get it on compassionate use. So it's not FDA approved yet, but it looks like it's very promising. And it's an IV and an oral agent. So on the therapeutic front, that is the only thing that I'm aware of at this point. Go
Yeah.
ahead.
What should patients and caregivers expect kind of, after a treatment of mucormycosis?
Well, I mean, in terms of once you're off antifungals, I think what that, it essentially means that everybody is checked off and said, this
Mhm.
disease is no longer there. We think this is done. Um, Relapse can occur, but it's usually in the setting of we left some infected tissue behind. It's almost like more of a surgical issue where essentially they didn't get it all, if that's the way you want to think about it. So we do have a lot of people, not a lot, but we have a number of people right now who are on posaconazole or isavuconazole, both active against mucor, um, lifelong because they have disease in areas that we can't get to. So again, in the base of the skull, which separates the sinuses from the brain. We've got 2 or 3 people currently who have very small but identifiable lesions in the brain that we believe are mucor because they occurred at the same time that they had disease in their sinuses. Obviously, those people will probably never come off it. But
Mm.
for the others, for people who are effectively cured, people like yourself,
Yeah.
um, you know, going about we going about our lives. Now,
Yeah.
sometimes they're going to go about their lives entering into, this phase of life with a certain disability. They may be
Yeah.
find like yourself that they no longer see out of one eye. They
Right.
may have to have cosmetic surgery. A lot of our patients end up with cosmetic surgery as a consequence of, the surgery that had to be done to get rid of it. Thank goodness we have
Right.
really, really good reconstructive surgery
Yeah.
operators that really do a fine job. But I think that once you're out of the woods with this, you're kind of going about your life.
Yeah.
You look at the things that caused it. Was my diabetes so far out of control that this was inevitable? So was my
Mm.
A1C 13 when it should have been 7?
Yeah.
That type of thing. Was I taking too much steroids for my lupus? Can we turn that down? Uh, if I'm a transplant, recipient, can we do something about my immunosuppression that lowers my risk of redeveloping this? So,
Yeah.
people move forward with their lives, but it's always with caution, caution and kind of looking over your shoulder. Kind
Sure.
of is it coming back, or are the are the circumstances that led to this in the first place, are they recurring? So
Yeah.
I think I would advise anyone going about your life, but
Yeah.
try not to replicate those circumstances that led to this in the first place, if they can be modified.
Right. Yeah. I know in my case, I was thrilled once, I was cleared to, be able to go back and start working again. I had pretty much gotten cleared from everybody that, hey, it looks like, things are done and over with, and we've gotten it taken care of. With the caveat to, you know, if anything arises or happens, give us a call back, let us know. So,
Yeah.
for me, it was slow. I had to get my strength back. It took me some time because at the same time, during all this time, I was also on pretty much strictly a liquid diet for the better part
Yeah.
of 2 years.
Yeah.
So,
Yeah.
and then once I, got that tube out and stuff, I was able to start eating solid foods again and got my strength up, and then was able to start working again. Of course, I work in the restaurants at the time, so I was going back and doing those sorts of jobs, and just living life with my wife. Kind of going through something like that. You're hit financially, you're hit in pretty much every way.
Yeah.
So now we're back to rebuilding our lives, and we've got things on the right track where we want them to go, and we thank God for all of that, and for all the caretakers and the treatments and the doctors. When I first started, like you were saying, I had 8 or 9 doctors, I believe, just seeing everybody, checking me out head to toe. So it's due to all that I'm still here. So yeah, once
Well,
again, thank you again
let
for
me
that, doctor. And
let me also give a shout out to two important family members. I met your wife, and I know her probably the best, but what
yeah,
a what a delight. I mean,
I know.
you're a very blessed man. That woman
Yeah,
was she was with you through thick and
mhm,
thin, and your mom.
I know.
Um, and I think
Yeah,
they're both you're very lucky, you're a very blessed man to have that kind of supportive family. You
yes, I
really
am.
are.
And she remembers everything. I couldn't. As a matter of fact, she was the one that wrote down even after all this time. She remembered the medications, everything, had them written down here for me, and I was just like, yeah, thank you, honey, because I didn't remember anything, and she was my she was my constant beacon, and of course, timetable. Like, hey, look, it's time to do this, it's time to do that, it's time to take your meds, and yeah, she was definitely one of my biggest supports. If not, she was my biggest support. And
Yeah, for
you
sure.
know, it's just staying positive and having good, good support members around you. So yeah, yeah, yeah. I I love her to death, and we were definitely meant for each other. Yeah, I'm so
Yeah,
thankful for her. Hmm.
yeah.
Going on with that, kind of finally, what supports are there available for patients and families, dealing with mucormycosis, kind of during and with the aftermath. I'll start off with saying, for me, like as we were just talking, it was my mom, my wife, my family, definitely friends, but also like my church. They helped out with even financially and things greatly. And I think there's more going on now, in this time than there was, kind of back 5 years ago when I was doing it, kind of like, MyCare, the organization. So,
Right.
it was, there's a lot more knowledge out there and things opening up. But can you just talk about, what you know?
Well, I wish I could tell you that there were fungal infection survivors support groups. There aren't. There are in some larger cities, kind of loosely structured um, support groups for people who've survived infections post-transplant, for instance. But I'm not aware of for instance, a support group or a social network that supports people who are going through or who have survived fungal infection. And now I say
Yeah,
that uh, to my embarrassment because, um, as you know, I mean, the amount of support that you require for something, for going through this, is not unlike a person going through cancer chemotherapy or cancer surgery or both. Um, and because because cancer has such a a hook, and it gets people
yeah,
into groups, and it lends itself to a lot of support and so forth. There are those kinds of support groups.
yeah,
Not so with fungal infection so much, but that's part of the reason that this group, MyCare, is important. It's really awareness. When
Yeah.
you understand that how common serious fungal infections are and how devastating it can be to people financially, personally, physically, their relationships, emotionally, etc. I mean, it really meets all the criteria that you would want to generate a support group. So again, I'm
Maybe
not.
something developing in the future,
Yeah, no, I mean, I think
Yeah.
that's why these conversations are really important, because you have to have people like you that are willing to step up and talk about it. But I've got 10 people that we currently, follow who would love to have something like this. Unfortunately, they're scattered all over the Southeast. They're
Yeah.
not all concentrated in one area, but even connecting online would be would be
Yeah.
probably a really useful thing for them.
Yeah, really. Yeah. I don't know. Well, Dr. Pappas, thank you for your time. It's been wonderful talking with you. We've covered a lot of information, and it's just like I said, going back and just remembering how well I was treated, and how well you did treating me, doctor. I'm so grateful. I'm so thankful. Thank you, sir.
Ricky, you're the best. You're the best, and I really appreciate you doing this. I'm gonna have to come down and eat in your kitchen one day. I understand
Hey,
you're really quite the cook.
yeah,
But
right. Hey, yeah, you would love it. I
I,
guarantee. Yeah,
please give my regards to your wife and mom, and
I will, doctor. Yeah,
and God bless you. Thank you so much, and thanks
yes, sir.
for your willingness to do this.
Yes,
You're the
sir. You're
best.
too. You're
All
the
right,
best
buddy.
too, sir.
All right.
God bless. Bye bye.
See you soon. Bye bye.